Hi, my name is Haley Cowdrey, and this is my video for my application to the nursing brand program at the University of Wyoming. I am currently a surgical technologist, and I am looking forward to the opportunity to get into the nursing program. Thank you for your time, and I hope that I answer your questions thoroughly. When it comes to an experience that has led to my ambition to be in healthcare and especially a nurse, I have to go back to when my younger sister was first born, and she had many difficulties with her urinary tract system because of her bladder being born outside of her body. Because of this, she had doctor's visits throughout her entire life, and just her experience with that and the procedures that she had and going with her to some of her doctor's appointments led me to my interest in healthcare. And so that's kind of how I've gotten to the road that I'm on now. I have loved my time as a surgical technologist and all the challenges that I have faced and conquered in learning all the responsibilities and roles that it takes to be a surgical technologist. And now I am looking forward to the new challenge that faces ahead and being able to expand my knowledge and skills to better help serve my patients. After working in healthcare for almost 10 years now and working alongside a lot of nurses in a lot of different departments in the hospital, it's really opened my eyes to all the different areas that a nurse can impact a patient's life. Nursing is a lot more than what you would think of when you're growing up, and just knowing that there's so many different areas that a nurse can work in and so many different avenues that your career can go down has really changed my tune on wanting to expand my education and my career path into the nursing profession. Some of the aspects of my personal life that would really translate well over into the nursing profession is that I'm a very reliable and caring person. I've always been very reliable when it comes to my fellow classmates and my coworkers, as well as my family. My entire life, my family has always come to me when they have problems or concerns, either just looking for my advice or knowing that they can always count on me to help them through whatever struggles they can be facing. For example, my younger sister has found herself in a very difficult living situation. And so recently I have gone out to Seattle to go get her and my niece and brought them back home so that they can have a better environment and a better support system for her to also be able to expand her career and her education as well, and just have a better living situation for her and for my niece. But it's just one of those things where my sister knows that she can rely on me and that she can come to me and that I'll always be there for her. And that's also how I am at work. I'm a very reliable person who's always there and is willing to pick up shifts or learn new things wherever the department needs me so that I can better serve the hospital and my coworkers and my patients. I have been traveling as a surgical technologist for almost the last 8 years, which has really given me the opportunity to diversify my background and the people that I work with. I've worked from coast to coast as a surgical tech, and so I've worked with people from many different areas of life with many different personalities and mindsets and ways of doing things, which has really helped me to just see different ways to accomplish tasks and different ways that doctors and other healthcare professionals have worked their way through situations. Being able to take aspects from many different people from many different facilities has really helped me to be able to diversify the way that I look at things, has helped me to be more efficient as a team member. I'm a very easygoing person when it comes to my work and the people that I work with, as long as there's nothing that is ethically or morally against how I feel or how things should be done. I have learned that there are so many different ways to do things that I'm not going to be a stickler for I have to do it my way or no other way. I know that there's many different ways to do things, and I'm willing to learn the way that you like to do things And with this mindset, I've been able to pick up many different ways to be able to do my job to be the most efficient tech that I can be. Um, Also, it has helped me. I've been able to see doctors from across the country handle different situations in different ways. I've been able to take this knowledge into other operating rooms where a doctor might encounter a situation that they haven't seen before, and maybe I have seen it in a different hospital, or I've seen a doctor approach it a different way, and then I'm able to help these doctors and kind of talk them through different options so then we can have the best outcome for our patient. I remember heading to my very first travel contract in Manahawkin, New Jersey, which was almost 8 years ago now. And at the time, I had only left the Midwest one other time in my life. I cannot even begin to describe the anxiety and nervousness that I felt about being in a completely different environment than what I grew up in. You always hear everybody talk about how rude the East Coast people are, and especially in New Jersey and New York area. And so I was just extremely nervous about if I was going to be able to handle the personalities and everything else, and just being the new kid on the block and not having any sort of support system around me. It was just me, and there was nobody else there that I knew. This experience really changed my life and my perspective on the country, so much so that I continued to travel for 7 more years. I still have friends that I talk to on a daily basis from that hospital, and my experience of traveling, and especially going so far away from home for my first travel assignment, really helped to diversify my background and my work experience, and just helped me to know that no matter what, you just have to be yourself and show that you know how to do your job and you're going to excel. It was just a great experience, and I couldn't be more grateful for the opportunities that I've had to be able to expand so much of my knowledge as a tech. I know controversy is a lot of people's least favorite thing. I know that I definitely don't like to be in conflict with people, and so I'm someone who likes to address issues head on, whether it's with a coworker or a manager or even just somebody personal in my life. You're going to feel a lot better if you just go and resolve the issue right off the bat instead of dwelling on it. And so in the OR, there are certainly times when I've had my managers, they will move people around with their assignments, meaning that they will switch who is doing what rooms that day. And when this involves me and what I'm going to be doing for the day, I tend to go and talk to my manager and just discuss with them why it was switched, because a lot of times it's because somebody complained about not knowing how to do something that's in their room or not feeling comfortable doing it. And for me, I see that as a problem, because as a tech or a nurse or any other healthcare professional, unless you are the doctor who specializes in something, you need to be able to have a very diverse and fluent background. It's important for our patient care that everybody is able to handle any sort of situation, because a lot of times when you're on call for an OR, you're going to get called in for everything. There are some bigger facilities that you only take call for your team, which is great, but a lot of hospitals don't operate like that. And if you don't have the skill set to be able to come in and cover whatever case might walk through the door, you're really hindering yourself and you're putting the patient at risk. And this is what I bring up with my managers when they do things like this, is that they need to not kind of cater to these people when they feel like they don't want to learn something new, because they need to be able to handle any sort of situation and should be able to assist any doctor in any surgery. And so typically when I approach the manager about this, they do see my point and they're much better about keeping people in their assigned rooms. And then when it's feasible with our staff, they'll also assign somebody else in there who might be more knowledgeable in that, so then they can kind of help people walk through it until they're more comfortable. But oftentimes a doctor, there's been many times I have learned so many things without having somebody there to help me. And I'll just be upfront with the doctor and I'll say, hey, this is kind of my first time doing this. I kind of know the basics, but you're going to kind of have to, tell me what you need or want, or kind of what your preferences are. And doctors are very receptive to you just being upfront about the fact that they're going to have to be a little more communicative about their needs until you get to know them more, get to know the procedure more. You really just hinder yourself when you don't broaden your horizons. And again, that's another reason why I'm applying to nursing school, is because I want to broaden my horizons, and more knowledge opens a lot of avenues in life. So while I was on a travel assignment in Arizona, I was faced with learning to help assist in neuro and spine cases, which is known to be one of the more intense and high stress specialties to work on in the operating room. I was very nervous in my confidence of even knowing the basics to be able to get through one of their like more minor surgeries. And I only had one day of having somebody assist me, that I would just try to soak up as much knowledge as I could from this person, so that I could better assist my surgeons. It was definitely a challenge, and it made me anxious about my confidence as a tech, because these surgeons can just be very intimidating and intense. And so, right off the bat, you just get nervous already, and you start questioning your abilities of being able to be a good tech. And so I always just remind myself that I do know the basics, and I quickly was doing neuro spine cases almost every day of my assignment at that hospital. And then later on, when I was almost done with that assignment, I was sitting in the lounge discussing with one of my new coworkers about doing neurospine cases and how I had learned them at this facility, and that now I had really good relationships with a lot of the neurospine doctors. And it was funny because my coordinator turned around, she was sitting in the lounge also, and said, "Wait a second, you didn't know how to do neurospine before you got here?" And I was like, "No, I learned with these doctors here." And she was like, "I thought that's what you specialized in when you came here." And so it was kind of just like a full circle when it came to my confidence, because I started out really lacking confidence in doing the neurospine cases, to turn around and it kind of boosted my confidence, because my coordinator thought that that was something that I had been scrubbing for way longer than I had. I'd only been doing it for 10 weeks. And, um, she thought that I excelled at it well enough that she thought that I had done it for a lot longer. So it was a nice full circle experience of just your assurance of your skills, and just being able to do your job well and everything. And so it was a great opportunity to learn more and build my confidence as a tech. And now I can feel comfortable doing just about any surgery.